Welcome to the Global Voices interview series. I'm Lana Wong, and we're streaming live from the World Bank IMF spring meetings here in Washington, D.C. This week we've had an incredibly busy week with thousands of development professionals, civil society, and global leaders gathered to discuss ideas and solutions for some of the world's most pressing challenges. This morning, I'm so pleased to have Zouera Youssoufou here with us today, who heads the Dangote Foundation, which is the largest private foundation in sub-Saharan Africa. So thank you, Zouera, for joining us today.
Thank you, Lana. Thanks for having me.
Great. Before we dive in, I'd also like to welcome our online audience and encourage you to please submit any questions you may have in the comments section of this video. So let's dive in. You are the CEO of the Dangote Foundation, which has a large mandate to improve education, nutrition, and health outcomes in Africa. Can you tell us a bit more about the work of the foundation?
So the foundation has actually been around since 1993, but we were given a large endowment of $1.25 billion by Aliko Dangote in 2014. And refined our strategy to now include specifically nutrition within health, education, which we were always doing, and then economic empowerment. So really the goal of the foundation is to use our resources to bring about change in the lives of people who are struggling. So whether it's improving immunization rates in Nigeria, making sure that women are able to give birth in better conditions, thereby reducing infant and child mortality, and specifically malnutrition, which is a problem that we're spending a lot of resources on. We have the highest rates of stunted children in the northern part of Nigeria. And so our goal is to make sure that those rates come down by first solving it, giving the children who are affected by severe and acute malnutrition treatment to help them get better, but also by having an impact on their families, because obviously a child that comes from this severely malnourished background is struggling. That's a proxy for extreme poverty, right? So treating them and then send them back home to the same family that produced them would necessarily give us the same outcome, and they keep coming back to the treatment centers. So we want to have an impact on the family as a whole. So support income generating activities so that the parents have money to take better care of their children. So the whole idea of the foundation is using our resources, our voice, our advocacy to improve health and education outcomes for people in Nigeria primarily, but in Africa more broadly.
That's fantastic. So the World Bank's Human Capital Project is a new initiative designed to accelerate better investments in people. Can you tell us why it's important for the private sector and civil society to partner with government to make these efforts happen?
So the work we've been doing, it was never labeled human capital development, right? But that's what we were doing. So it just didn't have that particular name. Why it's really important to partner with the government and with the different donors that are playing in this space, that are working in this space, is that nobody's resources are enough. So the government does all that it can do. It's trying to provide the best health services, put enough money in the budget, do universal health care coverage, so many things that governments are trying to do, but they can't do it by themselves. And so we see our role as a contributor, a complement to government's action, and also working with other development partners so that we can multiply and leverage off of each other and have more of an impact. So instead of working in a siloed way, this is what DFID is doing, this is what the World Bank is doing, this is what JICA is doing, how about we work together and kind of maximize everybody's results. So I think it's really important to work together, and that's what we've been doing. So this human capital development work, now that it has a name, so Aliko Dangote and Bill Gates had a meeting with the National Economic Council of Nigeria, so the body that runs the country, really, ministers, governors, etc., and said, look, we are putting our own resources towards this human capital work. Let's work together. And they said yes, and it just so happened that the World Bank came out with this index, and so we are all working together to see how we can improve Nigeria's ranking. Nigeria's not doing well in the bank's index or the UNDP's index by that same token. So the goal is to work together and really help bring Nigeria's ranking up. And that means making investments so that children have a better opportunity to grow and thrive and be productive citizens.
That's great. The joined up approach, right?
Yes, absolutely.
So the Dangote Foundation does a lot of work at the state level.
Yes.
Can you tell us why that's important and what are some of the results you're seeing?
Right. So Nigeria is a federal country, which means that we have 36 states and the federal capital territory where Abuja is, kind of like DC, which is in the state. And so the states are where all the action happens because the governors are the ones in essence who are running their states. So having a federal approach is not enough. You need to take it down to the actual state level where the results are. That's where people live. Right? People live in states. They live in a country, but they live in specific states.
Sure.
And we measure the results state by state. So for instance, one of the first states in which we're doing the nutrition program is Kano. Kano State, because it's one of the ones with the worst outcomes. And so joining up with the government to do, assessing where the primary healthcare centers are, making sure that they have what they need in terms of their ability to serve the population. So we've built 11 primary healthcare centers in Kano. That's where we're starting with the nutrition program. That's where we're doing a lot of work on immunization and making sure the children are getting the proper vaccines. So the results at the state level are what you aggregate to get a Nigeria-wide result, but we have to work state by state. And I think it's also important to mention the states because they're not all at the same level of development. So some states they all have different issues. So, what we would do in Sokoto is not what we would do in Enugu, for instance, because the issues aren't the same. The work we would do in Edo State is not the same as what we would do in Borno because the issues that they have aren't the same. So kind of customize the approach per state and really focus on the ones that have the bigger challenges. So not so concerned to have like a perfect geographical balance across the country, but if we're talking about severe and acute malnutrition, well, we have to go to the states where that's a problem.
The greatest need.
Exactly. So that's really the importance of really drilling down to the state level because that's where the action happens. Yes.
Right. Okay, thank you.
Yeah.
And so what do you think are the two most important things to better prepare our citizens for the future?
So it sounds so simple. It does, but it's obviously not because everybody's not been able to do it. I think having a solid educational base and being healthy, like the basics. Because if you're not healthy, if you look at a stunted child whose brain hasn't had the opportunity to develop the appropriate synapses, by the time they're 2, they've been, chronically undernourished, et cetera, that child will never fulfill their potential. Stunting is also irreversible. So those children are limited in terms of what they could do. They might not be able to become a doctor or an engineer or, a scientist or, work in artificial intelligence, which are those things that we need to prepare us into the future, right? So it's really important to get the basics right. Children have to have a chance to survive those first 1,000 days and get all the nutrition they need. Then they need to go to school and learn how to read, write, think, be creative. And then whatever happens after that will be necessarily better than if those basic building blocks aren't in place. The chances of success are limited. So what we need, especially now, that we have, these projections. I mean, the projections are scary about how many people we're going to have in the African continent, how many young people we have. Those people need to know and have a future. There's something, they have to be able to live, eat, survive, produce, contribute, thrive. And those things don't happen if people are sick and if people are not educated. So I think those are the basics.
But
I
couldn't agree more. So our viewers may not know that you were previously a World Banker, and now you're partnering with us. So what are some of the unique insights you have from that perspective, given that you've had those experiences?
It's really amazing, actually, to be back full circle like this. It's nice. What I can bring to the table, I think, to my institution now is understanding how development institutions work and how we can support the work that they do. So for instance, the bank is developing a nutrition program in Nigeria. So we're contributing to the trust fund because we want to also be able to help design, shape, guide the program.
And you have the knowledge from working on the ground.
Exactly, exactly. One of the things that I know is, when you're at the bank, you're a TTL, for instance, task team leader. You're really based in DC or not necessarily where your project is. So you're flying in and out, you're relying on other people. But if you have partners on the ground who are as invested in this topic as you, your project can be strengthened and be made better, right? Yeah. So those are the kinds of things that I see. Also because I know what the bank is trying to do, like the ultimate goal. And I was on a panel with Kristalina the other day. Exactly.
And poverty.
Exactly. That's our goal too. How do we really reduce that? What do we need to do on a systemic level to make sure that people have an opportunity to have fulfilled lives? And I've seen it from this perspective, like up here, and now I'm on the ground, in the trenches, in the villages with the people. I see what we really need to do. I think it's an amazing perspective to see how we can shape things from the policy level all the way down to the actual implementation on the ground where people are impacted by what we do. So I feel very lucky, really. It's been a great ride. Yeah.
Wonderful. Well, thank you so much, Zouera, for being with us today and sharing your experience and your commitment to the work that the Dangote Foundation is doing.
Thank you very much.
Thank you.
Thanks.
So thank you also to our online audience, and keep your eyes on this space because we'll have more interviews with wonderful global voices. Please add your voice to the conversation using the hashtag WBG Meetings. I'm Lana Wong, and I'm signing off for now, but see you soon online.